Hello everyone and greeting to our PBI1092 Academic English 2 lecturer, Madam Amy John. Let me introduce myself first. I am Valerie Minah with metric number 77056. We are from group 2 and my group members are Vivien and Bennet with metric number 77109 and Ted Wayne anak Basil Kevin with metric number 76968. Our topic for the presentation is types of stress. Stress is a normal bodily response that is needed for survival. Stress, according to the National Center for Complementary and Integrative Health 2021, is a physical and emotional reaction that people have as they face changes in their life. Stress may be felt for a brief period of time or for an extended period of time. Stress happens on a regular basis as a result of education, work, and family obligations. This form of stress isn't always related to a single obligation, but rather to a set of responsibilities. Stress may also be triggered by a major life change, such as being fired or divorcing one's spouse. There are three types of stress, which are acute stress, episodic acute stress, and chronic stress. So, that is an introduction to the stress. Here now is Vivien and Bennet to talk about the first type of stress. Vivien?
Thank you, Valerie. Hello, everyone. My name is Vivien Bennet, and my metric number is 77109. As for today, I will present about the first type of stress, which is acute stress. Acute stress is the most brief and common appearance stress, and it lasts for a short period of time. Reactive thinking, such as pessimistic feelings about recent circumstances or events, or potential situation events, or demand in the near future is the most common cause of acute stress. For example, if you recently been involved in an argument, you may have acute stress related to negative thoughts that are repetitive about the argument. Or you may have acute stress that is about an upcoming work deadline. Again, the stress is thought-induced. However, most often when the thinking-induced stress is reduced or removed, the stress will subside too. But if the stress meets the DSM-5 criteria, which is this DSM stands for Diagnostic and Statistical Manual of Mental Disorder, then individual may be diagnosed with acute stress disorder. There are some short-term effects of acute stress. The first one is transient emotional distress, which is some combination of anger or irritability, anxiety, and depression. The second one is transient muscular distress. It involves tension, headache, back pain, neck jaw pain, and other muscular tension that lead to pull muscles and tendons and ligaments problems. The third one is transient stomach. It's more referred to gut and bowel problems, heartburn, acid stomach, flatulence, and constipation. And last but not least is transient hyperarousal. It elevated blood pressure, rapid heartbeat, rapid pulse, sweaty palms, heart palpitation, dizziness, migraine headache, cold hands or feet, shortness of breath, sleep problems, and chest pain. Acute stress can present in anyone's life. It is highly treatable and manageable. There are some stress relief techniques for people to practice to help reduce acute stress, which are breathing exercise. It great for acute stress because they work quickly. The second one is cognitive reforming. Learn to change the way you look at the situation to manage your stress level. The third one is mini meditation. A quick 5-minute meditation technique can help you to calm down in the moment. And the third one is progressive muscle relaxation, which is PMR. It's like breathing exercise. PMR will give you a moment to regroup and relax. However, we should always aware that repeated acute stress can become very harmful for your physical and mental health. So, that is the first type of stress, which is acute stress. Here now is Valerie Minah. She currently taking counseling course in year 1. She will talk about the second types of stress, which is episodic acute stress. Valerie?
Thank you, Vivien. Hello once again. I am Valerie Minah with metric number 77056, and I am going to talk about episodic acute stress. Episodic acute stress is the second type of stress. Unlike acute stress, which is the most brief and common appearance, and it lasts for a short period of time in response to relatively mundane stressors, anyone with episodic acute stress experiences extreme stress and life or death feelings. According to Lifestyle's Health, others may dismiss these people as overly emotional, but they do not realize that episodic acute stress disorder is a real illness. Furthermore, the individual with the condition experience stress, which can lead them to believe that these are life or death circumstances. Someone can, for example, miss a job deadline and then have an exaggerated reaction. Even if the person's employer isn't particularly enraged, the patient may begin to fear losing her job or his job, being homeless, and dying on the streets. Irritability or uncontrollable indignation, rapid heartbeat, panic attacks, and more are the symptoms of episodic stress. This condition, if left untreated, may lead to more serious health issues such as heart disease, persistent headache, and hypertension. Next is the treatment for the episodic acute stress. Lifestyle modification, counseling, and medicine according to Lifestyle Health can all be used to treat episodic acute stress disorder. Changing occupation or beginning a physical exercise are examples of lifestyle changes that therapists may suggest. When a patient's stress is too much for them to manage, medication will help. So that is an explanation on episodic acute stress. Here now is anak Basil Kevin to talk about the last type of stress. Ted?
Chronic stress is a long-term, chronic state of anxiety that, if left unchecked, may have a negative impact on your health. It may be brought about by a normal family or job stresses, as well as stressful events. Chronic stress happens when the body is exposed to stressor on a daily basis with a frequency or strengths that prevent the autonomic nervous system from activating the relief reflex. This indicates that the body is always arousing. People are designed to withstand acute stress, which lasts for a brief amount of time, but not chronic stress, which lasts for a long time. It's crucial to learn what chronic stress is, what causes it, and how it affects the entire body before you can start treating it. Our lifestyle causes this form of chronic stress respond all too often. Anything from high-risk work to isolation to congested traffic will hold the body in a state of danger and constant stress. In this scenario, our fight-or-flight reflex, which was programmed to help us to deal with life-threatening conditions on occasions such as swerving to avoid a car accident, will break down our bodies and make us sick, either physically or emotionally. Source of chronic stress can be varied, but often fall into 4 different types, such as emotional stress, environmental stress, relationship stress, and work stress. These symptoms can vary in their severity from one person to next. Some of the most common signs of chronic stress include ache and pains, decreased energy, difficulty sleeping, disorganized thinking, fatigue, and many other symptoms. Cognitive behavioral therapy (CBT) is one approach that will help you learn to recognize repetitive of thinking patterns that lead to persistent stress. With the aid of psychiatrists, you will try to replace this negative feeling with more realistic and supportive one. You should also learn coping technique to help you properly control your stress response. Another technique, mindfulness-based stress reduction (MBSR), can help people use mindfulness and meditation to help to deal with chronic stress. To help you control some of symptoms of stress, your doctor can prescribe a variety medication. Your doctor might recommend an antidepressant if you have already anxiety or depression symptom. Here now is Vivien to talk about the conclusion of stress. Vivien.
Thank you, Ted. So, in the final analysis, there are 3 types of stress, which are acute stress, episodic stress, and chronic stress. Stress is a natural bodily reaction that helps us survive. People experience stress as a physical and emotional response to change in their life. Stress can last for a short time of period or for a long period of time. Education, jobs, and family responsibility all cause stress on a daily basis. Stress can present in anyone's life. It is treatable and manageable. However, repeated stress can become very harmful for your physical and mental health. So, try to coping your stress for a better and positive life. That's all from our group. Thank you.